Queen Elizabeth Central Hospital is one of the biggest referral hospitals in Malawi, which accommodates over 1,000 patients in its wards. Adults with acute medical conditions often present late to health care. Consequently, they may be faced with delays and lack of resources in secondary care settings. Such challenges are likely to increase vulnerability and contribute to the high observed rates of morbidity and mortality.
Being a nurse, every time you wake up and you're going to work, your expectation is you're going to help patients. And there's not enough resources there for you to use. Sometimes you even see a patient dying right in front of you, and yet there was something you could have done if you had the right equipment to use.
We've lost most of the nurses who were trained for HDRU care. As a result, the care is not very adequate, it's not up to date, it's not the expected care that we are giving to our patients.
We don't have the right equipment for an HDRU. For instance, we don't have enough concentrators, and those that we have, they're not well functioning, and we don't have enough blood sugar monitoring equipment.
The need for high dependency unit is much more in terms of helping to look after the critically ill patients, to help stabilize, resuscitate patients that are much sicker.
Provision of increased nursing care and improved monitoring for unstable, critically unwell patients could profoundly improve patient outcomes. Malawi Liverpool Wellcome Trust's aim is to support the development of a specialist medical critical care area integrated within the existing healthcare system at Queen Elizabeth Central Hospital.
At least expect an HDRU which has got oxygen pipes that are going to be ready for use at any time. Yes, and also we expect to have at least equipment like the HB machines to check at least. You know, those are some of the things that we have that delay the provision of care to the patients.
Through development of this unit, will expand our ability to look after the critically ill, but also will be able to venture into some form of research that we are not able to do before.
High Dependency Respiratory Unit has a bed capacity of 9 with 10 registered nurses and 4 housekeeping staff. Our unit focuses on adult medical conditions, but we prioritize those who have respiratory problems, who can benefit more from being admitted in high dependency and respiratory unit.
I'm so excited to be working in this HDRU. It's so different from the other HDRUs that I've been in for the past 6 months, mainly due to the new equipment that we have here. It's so easy for us to monitor patients.